Prevention of Doctors Assault Bill. This bill is a paradigm shift in the existing legislation which exists today. We have over 20 legislations to prevent an assault on doctors. They are hardly adequate. They are all wanting the doctors to complain and then a police case to be registered. What we have done in this bill, which is drafted by Aparmita and me, is very path-breaking ideas, innovative ideas of having a scorecard, of having behavioral issues, structural issues which can be implemented, an ombudsman kind of a structure for dispute resolution and grievance redressal cell. A scorecard, as I had just mentioned, would be used for scoring by the doctors of the patient's behavior and the patients of the doctor's competence and the way in which they conduct themselves. So this bill covers a lot of such issues which have behavioral aspects, which have structural aspects, and it will be an amalgam of all the laws which would then eventually, if I were to name it, it should have become the Medical Services Code. So this bill, if it is enacted in the way we have drafted it, will eventually, in a pyramid structure, have all the issues ailing the patients and all the issues ailing the doctors and the assaults on them would be addressed by this bill. Now this slide which is up before you, at least 75% of doctors who practice medicine all across all the pathies have a reported assault or aggressive behavior by patients. These are numbers which have been given by doctors. These are the reported cases. I do not know how many unreported cases there would be, and I dread to even imagine the percentage of such assaults on doctors. I'm sure it's nearing 100%. So there is an absolute immediate need that we move from a discourse, because a lot of people are talking. It's only a discourse which is happening. There is no concrete action on ground of what is happening or what changes have to be made. This bill which we have drafted is exactly that. Now it takes care of the structural issues like lack of security, insufficient media barges into hospitals asking for interviews and bites from doctors, intruding into their space of providing effective service. So guidelines for the media and so on and so forth. Now we would be happy to share the bill with anyone and everyone who wants to read. Since time is short here, I cannot give a proper discourse on my on the bill itself. But we will be happy to engage with any and all the stakeholders who want to change the situation of doctors getting assaulted. Let's not forget, it is these doctors who stood up for us for 2 whole years, not going home, rarely going home, leaving their newborn babies at home, wearing those ridiculously uncomfortable PPE kits for hours and hours and hours and hours and hours together, just to make sure that we survive COVID. These are the same doctors who did not bat an eyelid or flinch anything, but provided service to the Orissa train accident victims and survivors. If they are not protected, what is their incentive to serve patients? If we attack them, it raises an issue of anxiety, it raises an issue of uncertainty, it raises a security issue on them. It's their honor that they are treated properly. This bill addresses the issue of honor.
Mr. Abhishek, we just have gone through this presentation, and if we are looking at from the viewpoint of the patient, and I would just want to know for the common man, today, like, because the media's portrayal or whatever XYZ issues are there in the corona, when hospitals are overcharging, so it escalates to price. And,
very good question. I'm sorry I'm interrupting you,
please.
But in the bill we have put in structural issues, the remedies that we have put is that large hospitals which are over 100 bedders, which have an ICU and an emergency services facilities, must have a department, categorically separate department for redressal of such grievances of billings or of inadequate medical services which have been provided. And in these departments you would have an HR type of a qualified person who's trained in psychology, in soft communications, and how to handle a crisis situation. In the behavioral issues, what we have suggested and what we have seen by serving a large number of doctors are trained to deliver medical services, to be trained as physicians, to be trained as surgeons, but they are never trained in soft skills or in communication skills. These issues of assault happen because there is a lack of communication or improper communication, mostly from the doctor's side. Of Of course, I'm not trying to absolve the patients and their relatives who are trying to take advantage and assault doctors. But the doctors need to learn communication skills. So we have proposed that as of compulsory credits in the medical education system, a proper course by an accredited communication university or a college needs to be introduced and dovetailed with the medical curriculum, so that doctors across all the pathies and specialities and even paramedics are trained in communication of how to communicate to a patient and the relatives, how to handle record and data, how to preserve the data privacy and confidentiality, and a lot of other softer skills which are need to be imbibed by the doctors, and then one will see of how the situation changes. Now this also has, the bill has certain features which we have put into our salient features, where if the patient misbehaves, therefore we have come out with an absolutely first of its kind in India scorecard system, that if patients misbehave, the doctors will rate them from a 1 to 5 score. If the doctors are not providing proper services, the patients will rate them on a 1 to 5 score. Green, red, orange kind of a coding. So when an appointment is fixed, the doctor knows how the patient is likely to behave, or when a patient is seeking out a doctor, they know the competence level. So such things we have done. What we have also suggested in the bill is that a app should be created, which possibly would already be there, but we would be happy to suggest and guide a app maker who can make apps on how all the healthcare system can be integrated into that app, where the prescription management, the medical history of the patient, everything is available on an app. And like the Arogya Setu app, these apps also will have so if I'm in Kanyakumari and I fall ill in Sikkim, my doctor need not call up the Sikkim doctor to explain my history. It will all be available on that app, and many such features. I would request my colleague Aparmita, who has helped me immensely to draft this bill, and in fact I must give due credit to her also. If she could speak for 2 minutes on the
Can we
bill.
request you to join in for a second? Please.
But her views also would be very important. Thank you so much.
Welcome. Please stay on. Hello.
Hi.
Yeah, you could introduce yourself and talk about this. And we were asking him. He's told about that app part.
Right.
Where you're trying to design something.
Right.
And I wanted to know from the patient's perspective.
Right.
And then, as you said, that media. So if you want to just highlight what is media, how if they're too sensitive about it, then what is the way they should behave?
Exactly. So these are really big issues, and I am a law student. My name is Aparmita Tiwari. I'm a student at NLU Nagpur, and I'm working with Sir actively on this bill. So the first issue that you talked about is the issue of media. When we look at media and the manner in which they are portraying doctors, it is actually creating a trust deficit in our society. If you look back in time, maybe when you were young, doctors were considered gods. But that image is diminishing today, like anything, where any reporter feels that it is totally normal to barge into a doctor's cabin and ask them questions. And what kind of an impact is being set, what kind of an image essentially is being given to the normal citizen of the country? So because of this trust deficit that is being created due to sensationalization of medical news, patients are already going into the clinic with a lot less confidence in their doctors. And if anything goes wrong, now the doctor is not God. They do not have life or death in their hands. They try their best. But the moment something goes wrong, what is it that goes on in your mind? You say, oh, I heard that media report. This doctor is maybe giving me the wrong prescription. Doctors are, doing all sorts of...
Another question which comes to my mind, I was speaking to Abhishek ji, and through you I want to know.
Right.
Going from an unbiased mind,
Right.
that suppose if you do a survey
Right.
today in any hospital, and first thing is whether we are doing it in cities, urban areas, or are we going to rural villages में हम लोग जा रहे हैं क्या नहीं?
Right.
Because during Corona there was a lot of issues with the big hospitals
Exactly.
where patients got inflated bills. Or
Exactly.
there's a issue which I know is about the insurance, right?
Right,
So if I have a Mediclaim,
Right.
now my Mediclaim is 1 lakh or 2 lakh. So what the hospital does is they take you in.
Right.
After they take you in,
Right.
they finish you with that 2 lakhs, sum.
Right.
Then they'll bring more money.
Right.
Or then they, as in Corona, they said they were put on the ventilators. So now
Right.
patients or patients' relatives or friends were sitting outside.
Right.
So they say ki body nahi de rahe hain, you know, all that
And
things were
all
happening.
those things,
So
exactly.
I just thought, I don't know whether you people have done a survey.
Yeah.
And what are
So-
the, you know, means some, have you done it?
So you very rightly pointed this out. See, nothing is ever black and white. Everything is about maintaining a delicate balance. So the balance, what is the balance when we talk of this issue?
Yes.
The balance is the accountability of the doctors and the satisfaction of the patients and the obligations of the patients as well.
Yes.
How do we balance this? Now, if you go to the root cause of this, then doctors have to also become accountable. Most doctors are. But you know that one bad apple can set the very wrong precedent.
right.
So those people need to be held accountable for what they do. And as you this very rightly mentioned, this balance needs to be maintained.
Yes.
Now, what we are trying to do with this app is we are trying to propose an all India app which if you have ever used Ola or Uber, you always have to rate the driver.
Yes.
Right?
At the end of it.
And whenever you go into some cab, you always look at the rating of the cab driver. So you already know in advance if the cab driver is good or not. So what we are doing is we are doing a two-pronged thing. The doctors are going to be rated by the patient,
Yes.
and the patient is going to be rated by the doctor.
Yeah, that is, I don't know, means Abhishek just mentioned about that.
Right.
And
So
पेशेंट्स का या उनके रिलेटिव्स का वो
Right.
डॉक्टर्स कितना मैपिंग कर पाएंगे आई हैव गॉट
Exactly.
आई डाउट मतलब दे वोंट हैव द टाइम टू डू इट you know basically like abhi I just give you a case. Suppose like I am a journalist,
Right.
and I am just telling you my experiences when I travel in Delhi locally.
Right.
So people say कि जैसे we had serials
Right.
जसपाल भट्टी
Right.
जिसमें वो दिखाते थे बाबू, you know, somebody goes in a बिजली का दफ्तर, what problems he faces.
Right.
So when he goes into the, suppose I am working in a जल बोर्ड में काम कर रहा हूँ मैं.
Right.
मैं पानी के वहाँ पे I am the king. And somebody else is working in a other department, electricity. So
Right.
would ऐसे मैं बोल रहा हूँ डॉक्टर्स के भी तो ये नहीं है कि डॉक्टर्स के पेशेंट्स नहीं है.
Right.
जो डॉक्टर अगर मेरे चाचा is a doctor, his son is a doctor. So
Right.
sometimes they'll also face, there'll be patients in another hospital.
Right,
So
right.
that, you know, I think the synergy जो मतलब एक वो मेंटेन करना, हार्मनी.
Exactly. So वो हार्मनी का जो पॉइंट है, इसलिए हम कह रहे हैं कि ये यूनिफाइड ऐप होना चाहिए.
Okay.
और रेटिंग के लिए आपको सिर्फ 1 सेकंड लगेगा. 1 सेकंड. You just have to click 2 star, 3 star, 5 star.
No, it's very good. I think
So
if it
once
comes up.
वो एक बार
gonna
एक
be
ट्रेंड
really
बन
nice.
जाएगा ना,
Yes.
तो 200 से ज़्यादा डॉक्टर्स, जितने भी डॉक्टर्स के पास वो पेशेंट जा रहा है, उसकी रेटिंग्स आएंगी. अब डॉक्टर्स के मन में भी तो डर है ना, अगर मैं डॉक्टर हूँ, कोई भी पेशेंट आके मुझे मार सकता है.
And,
तो उनको ये रेटिंग देख के उनको भी पता है कि इसका बहुत अच्छा रेटिंग है, तो ये
And I want to
कम
know,
डरने की
Abhishek,
जरूरत है.
like when we're talking about this app and ratings and things,
Right.
so private hospitals will be convinced, you know, but whether the government, when it comes to the government, CGHS and all,
So what we
will
have
they
said
accept it?
is, what we have mentioned in the bill is not an option for
You
government.
also be there.
Not an option for the government institutions to opt out of.
Right.
It will be an omnibus applicable bill or an act as and when it becomes, and it will be mandatory for every service providing institution to follow it. If you want to save yourself from an assault, it cannot be eliminated 100%, it's not possible. But if you want to prevent it, then the idea and the action is in your hands. You have to take that minimum effort of rating. You have to take the minimum effort of making sure that whatever we have suggested in this is being followed.
एंड टू ऑल्सो ऐड टू दिस, जब कोविड के समय जैसे ऐप था, वेर एवर यू हैड टू ट्रैवल, वो गवर्नमेंट का ऐप था, सबको करना पड़ा था.
Exactly.
तो उस टाइप का हम कुछ इन्विजन कर रहे हैं.
Yeah, no, it's I think a very nice step.
सिर्फ ये भी नहीं, उसमें पेशेंट की सारी डिटेल्स हों कि उसके क्या मेडिकेशंस हैं, क्या हैं, तो एक साथ सब डॉक्टर को मिल जाए. इनफैक्ट उसमें हम ये भी चीज़ें डालना चाहते हैं कि वो मल्टीलिंगुअल ऐप हो.
Okay.
हर पेशेंट कोई गांव से आ रहा है, कोई शहर से है, जिस लैंग्वेज में वो कंफर्टेबल है उस लैंग्वेज में वो आप उसके लिए अवेलेबल हो, और जितना अच्छे से
Right.
यूज़र फ्रेंडली हो सकता है उतना हो. बट इसके लिए वी रियली नीड द सपोर्ट ऑफ द गवर्नमेंट.
Yes.
एंड वी आर वेरी होपफुल बिकॉज हमारी गवर्नमेंट जो है इंडिया की एज ऑफ नाउ बहुत सारे स्टेप्स लिए हैं.
Right.
इनफैक्ट वो डिजिटल वे में जाना चाहती हैं हेल्थ केयर को लेके भी.
मेरा सवाल है कि हैव यू, आप लोग की जो अभी हेल्थ मिनिस्टर हैं मनसुख मांडविया जी, क्या उनसे आप लोग का कुछ इस बारे में चर्चा हुई आगे?
तो हुई नहीं है, बट थ्रू द एजेस ऑफ मेडस्केप इंडिया वी
Yes.
वुड बी रीचिंग आउट टू हिम एंड सीकिंग
Yeah,
एन
from
अपॉइंटमेंट
MedScape, and she is the right source.
and making a presentation to him as well.
राइट। हम बस वो सपोर्ट चाहते हैं, आइडिया हमारा, हम चाहते हैं कि ये गवर्नमेंट इम्प्लीमेंट करे और हमारे देश के लिए
You have
बहुत बड़ी
silent future of the bill.
जी
what आप कह रहे हैं इस बात में, तो गवर्नमेंट को आपने अपना ये दिया है जिस पे आप उम्मीद करते हैं कि ये गवर्नमेंट से
हमने अभी सरकार को इस कॉन्क्लेव के माध्यम से सरकार के सामने प्रस्ताव रखा है। अब हमारी ऐसी आशा है कि सरकार इसके ऊपर थोड़ा विचार विमर्श करे, सोच विचार करे। जब भी जहाँ भी जो
अभी
भी
ये बिल आया नहीं है।
नहीं, ये तो हमने
आपने अभी
ये आज प्रेजेंटेशन कर रहे हैं इस
और
कॉन्क्लेव
इसका
में।
एक चीज़ मैं और बोलूँगी कि ये हमारे डॉक्टर्स के बारे में नहीं है, क्योंकि अगर लोग डॉक्टर बनना बंद कर देंगे ना तो ये हमारे बारे में भी हो जाएगा।
क्या आप डॉक्टर ऑफ बोर्ड के पास में भी आपने इस बात प्रपोजल को रखा है?
हाँ
कि
रखा
ये-
हुआ है।
आज ये इवेंट के थ्रू हम यही चीज़ करना चाह रहे हैं, बिकॉज मेरी पर्सनल स्टोरी भी मैं
तो ये इवेंट आपका पहला इवेंट है जो इसके थ्रू आप दे रही हैं?
ये बिल पहली बार यहाँ प्रेजेंट
तो
हुआ।
यहाँ पे
Present
जो
आज
लोग
हुआ है
आए
ना
हैं,
अभी,
क्योंकि
exactly.
केरला में जिस महिला डॉक्टर की हत्या हुई थी निर्ममता से, उनके ही कैबिन में उनके ही स्कैल्पेल से उनके हृदय को जो चीर दिया गया था, उसके बाद ही हमको ये विचार आया कि इसके ऊपर एक अच्छा बिल हम लोग बनाएं। तब हम दोनों ने इसके ऊपर काम किया। उस डॉक्टर सुनीता दुबे जी ने इसके ऊपर काफ़ी गाइडेंस भी दी है और यहाँ पर आकर के हमने इसको प्रेजेंट किया है। अब यहाँ से जाकर के अब
क्या
जो
लगता
हेल्थ
कि
मिनिस्टर
आगे
है और बाकी जो हैं उनको
आगे क्या लगता है आपको कि ये गवर्नमेंट आपको मानेगी, आपके बिल को मानेगी, आपके प्रपोजल को मानेगी और वो बहुत जल्दी इम्प्लीमेंट हो सकता
सरकार
है?
की सहायता करना हमारा कर्तव्य है। सरकार के पास और बहुत सारा विजडम होता है। अब वो इसको किस दिशा में लेके जाना चाहें, इसके ऊपर मैं टिप्पणी नहीं कर सकता हूँ, बट जितना भी योगदान हम कर सकेंगे हम बिल्कुल करेंगे।
धन्यवाद।
एक मेरा आखिरी सवाल तो नहीं है, मैं चाह रहा हूँ कि आप जो लोग वीडियो देखेंगे तो वो लोग चाहेंगे दिल ट्राई टू रीच यू, आपको तो हाउ डू मतलब दे कनेक्ट विद यू, अगर आप लोग अपना ईमेल या कोई शेयर करना चाहेंगे तो?
So my email is abhishek@kharelegalchambers.com. I'll be happy to receive emails and answer any queries that may arise from those emails. I'll be only too happy.
Because
to
like
answer
when they see that, so if they want the bill is in how many pages? The right now जो आप लोग का
It's right now only 20, but it's work in progress.
So any people can have a link and you can share them that.
Of course.
यही है
So
हमें
we
बस
just want to means educate the people around us.